Hi, my name is Kate Halligan, and this is Module 4. The goal of this project was to be in a virtual real world scenario that you would be like in the emergency room or a work setting in the hospital. And our goal of this was to find out what was wrong with the patient and come up with a diagnosis. So the scenario of what happened was that the emergency medical services, are also known as EMS, team had brought in a 54-year-old female patient into the emergency room, emergency department, where I was working. When the EMS brought the person, they stated that the patient was found wandering in a nearby park by a jogger, and the jogger had called 911 from her cell phone because the woman was screaming, and then she fell. She scraped her arm and her face. When the EMS found her, she was bleeding, disoriented, combative, accusing the EMS team of stealing her purse. Her hands were shaking severely, and she is shouting at the doctors and nurses that she needs a bottle. This woman's clothing is dirty, and you can smell stale body odor and urine. So the symptoms that the patient is presenting with was wandering, bleeding, disoriented, combative, shaking hands, shouting, confused, agitated, bad odor, and delusions, and also hallucinations. After doing some research, I do believe that the 50-year-old female is suffering from schizophrenia. So schizophrenia is the most common psychotic disorder. It affects over 2 million people just in the United States. This psychotic disorder can happen to anyone. The most common population that this happens to is urban populations and also the people in lower socioeconomic groups. And unfortunately, we still do not know what causes schizophrenia. Some of the signs of schizophrenia include delusion, mood change, confusion, wandering, shaking. And then another sign of schizophrenia is not being able to smell the odor that it was coming off of her skin. So that is another side of schizophrenia, and that was something that the patient was presenting with. When it comes to schizophrenia, there are two different types of symptoms a patient can have. They can either have positive or they can have negative symptoms. Positive tends to deal with the exaggeration of normal functions, which means that the patient is distortion of perception that could cause the patient to then have hallucinations. Hallucinations can be defined as hearing and seeing things that are not real. And then the negative symptoms include terseness in speech, social withdrawal, and unable to experience pleasure and apathy. So the treatment for schizophrenia is going to be medication and also psychosocial therapy. The medications that people with schizophrenia have are called antipsychotics. About 20% of all prescriptions in the United States are written for antipsychotic patients. It is intended to alter their mental process and also their behavior. So get them back to a normal functioning level instead of being in that psychotic state of mind. When it comes to the types of antipsychotics, there are a bunch of different groups. They're divided between phenobenzine, thiazide, butyrophenines, dibenzodazepines, and derivatives of Doloin. This medication is normally, any of these groups of medication is normally to do with the schizophrenic patients that are presenting with positive symptoms. Some of the adverse effects of this medication include sexual dysfunction, dry mouth, and sedation, and akasia. Defining psychotherapy, psychosocial therapy is a method of treatment along with the medication. This will involve learning and using coping skills to help with schizophrenia. It will help manage the illness, improve the quality of life. It will help reduce the relapse, help through thinking normal processes, and it will also help with daily activities. Unfortunately, in today's state, that people that do suffer from schizophrenia are still not fully recovering from this. Some of the short-term health risks of schizophrenia include anxiety and overwhelming fear. They'll most likely have substance abuse, addiction. They'll suffer from isolation, suicide, paranoia, and they will also neglect medical care that sometimes just deals with because of what economic group they come out of, and they might not have insurance or they don't have the money to afford it. And then they also have issues with their family. They distance themselves from that, and they also will have paranoia. Some of the long-term effects of schizophrenia include dementia, bipolar, alcoholism, poverty, tremors, and death. When talking about her hand shaking of the patient, the question was asked, it was asked, why do you think the patient's hands are shaking, and what do you think causes her confusion and combativeness? So I wrote for hand shaking is because that schizophrenia can cause movement disorders like repetitive movements. They will also have general clumsiness, which is also a huge sign of schizophrenia, and that could be what caused her fall when she fell in the park and that jogger found her, and that's when she got the blood on her arms and everything like that. And then it could also if she is already on medications, that could cause some of the side effects include having a tremor. So that could also be the issue. When it comes to the confusion and combativeness, I do believe it was because she was in a psychotic state. She was having a psychotic episode. This is an episode will have confused thoughts. It will cause them to have a hard time concentrating, keeping a conversation going, keeping their thoughts sane. It will also cause them to have the change in behavior like she did, accusing the EMS of getting angry and accusing them of stealing her purse. And also a huge thing with schizophrenic patients is that they could 1 minute be fine and then the next they could be angry. So bipolar unpredictability is a huge one. She also came in very agitated and unpredictable, so that is very hard for them. That's why she came in like that. My assessment that I believe needs to be done for the patient would include having a physical exam, getting a psych doctor so that they can do a psychiatric evaluation, and then also do some tests and screening on the patient. So the physical exam will help rule out if there's any other issues going on, any other complications that could be related to this. The test will show if she's using alcohol, abusing it, misusing drugs. It will show if her heart or her troponin, any of her blood levels are elevated. And then some other tests would include an MRI or a CT scan to see what is going on in her brain, and just to make sure that she doesn't have something else going on in there. So then the doctor will help check the appearance of the patient. She will ask the patient about how she's feeling, how her moods are, what her hallucinations were, her delusions, if she uses substances, and has she ever had issues with suicide attempts or felt like she was going to. And then she will also talk to the family and try and find a background on this to see if someone else in the family does have a history of this. So then the research question asks, mental illness management includes both pharmacological and other therapeutic methods for treatment. Summarize how this is managed and support of insurance. Is it sufficient? What could make it better? So unfortunately, I do not think that mental health is taken seriously, especially in an insurance world. Mental illness, if it is diagnosed, insurance does not have to pay for it. So even if you have a psychotic episode, but it was already a predetermined condition that the patient had, insurance can choose not to pay for their next treatment. Insurance will help find different ways or different places that the patient can get their medication or go to a treatment center, but that doesn't mean that that treatment center is exactly the right fit for the patient. So I did write that the treatment depends on what type of diagnoses you have when it comes to mental illness. The severity of the diagnosis will also determine what type of treatment you will get. A lot of the patients that suffer from mental illness will need a combination of treatment, like was stated before. You'll need medications and also psychotherapy or other therapeutic methods. The purpose of psychiatric medication is to improve symptoms that the person is having. If the patient is taking medications properly, it will allow for a good psychosocial therapy treatment, which will have a better outcome for them. The huge issue with insurance, like I said, is that the insurance will influence the patients and where they can actually go, and why people with mental illness fail and have relapses so often is because of their socioeconomic standings, how much it costs, like their copay, and so it makes it, and their out-of-pocket cost. So it makes it very difficult for these patients to see the worth of paying the out-of-pocket, and then that's why they relapse. I do not think that health insurance does enough for mental illness. And just look outside, there's so many homeless people that are not well and they do need help, but there's not enough support in the system. I think that they need to change the way they do things. And I also agree, I believe that not every person is going to need the same type of treatment plan, and that shouldn't be determined based on your insurance. There should be different types of therapy available for all different socioeconomical classes.